Good afternoon, everyone. My name is Zeta Granberry, and I will be discussing the neonatal surgery profession. For me, I knew that I wanted to be in the medical field since basically forever. Both of my parents are in the medical field in the Air Force, so you could say that it is in my blood to follow after them. The only difference between them and me, however, is that I will be going to college and medical school before enlisting. I personally wanted to become a neonatal surgeon because I believe that is the perfect occupation for anyone who enjoys fast paced environments and working with very young children, especially babies, which describes me perfectly. All right, so on to the information on the actual profession itself. So, what is a neonatal surgeon? They are surgeons, of course, who perform surgery on critically ill newborns or unborn babies. So, basically, if we saw on an ultrasound that a baby had any type of illness, defect, or abnormality, we could go in and perform surgery on both the mother and the baby at the same time and correct any of these problems. Then we would put the baby back into its mother so it may be born normally. As everyone knows, any type of medical profession comes along with a long duration of education requirements, and you must also obtain a lot of licenses before you can start practicing your profession. For education, you would have to complete 11 to 16 years of post high school education. That will be 4 years of college education. It does not matter the degree you get, but you must be able to understand that you have to take and pass the medical college admission test, or better known as the MCAT, to determine your acceptance into medical school. So it is best to major in more science-based and medical-based majors so you may be better prepared for this test. After college, you would enter into 4 years of medical school, and after that, you would do 2+ years of a desired residency. For licenses that you must obtain, neonatal surgeons and every other physician must obtain a medical degree from an accredited medical school. After that, you must take and pass the 3-stage national licensing exam during and after medical training. For MDs, that exam is the U.S. Medical Licensing Examination. For DOs, that's the Comprehensive Osteopathic Medical Licensing Exam. After passing these exams, you would be nationally recognized as a physician, but that does not mean states would recognize you themselves. So you must then take and pass state-specific licensing exams so that you may be officially called a physician. For neonatal surgeons specifically, you must become a licensed pediatrician before you can specialize and go into neonatology. For the job duties and responsibilities of a neonatal surgeon, you must perform surgeries on newborns to correct and prevent problems or deformities in babies, aiming to improve their way of life or future way of life because they're just born, according to salary.com. You must also follow strict instructions and pay attention to detail while performing these surgeries. Neonatal surgeons also work in fast-paced and stressful environments and work closely with perinatologists and neonatologists, according to Johns Hopkins All Children's Hospital. For physical and mental demands, you must be able to stay calm in stressful situations and be able to put small parts together. Obviously, since the babies are really small, so their organs are small also, so you must be able to do those type of things. You must be able to assess difficult situations and come up with the pros and cons of certain decisions and procedures according to surgeons at My Next Move. You must also work in a fast-paced environment and interact with many different people daily, including the babies themselves, the mother, and other family members. All this requires high levels of skill and expertise. Neonatal surgeons, along with other surgeons, are able to call themselves one of the most highly paid professionals in America with a salary of $280,000 to $310,000 annually. They are also one of the most important physicians in the medical field, so it will not be that hard to find a job because all hospitals need you. They also have a relatively flexible work field, meaning that they can work in a general practice, which would be, for example, pediatrics, or in an area of specialization, which, for example, would be neonatology. For promotion and advancement potential, neonatal surgeons can obtain a higher position in the hospital, which will come with an increase of responsibility. Some of these positions could include becoming an attending physician, which, for those who do not know, you would help people who are just fresh out of medical school and you would help them with their residency, giving them tips and advice on how to better their career and prepare for actually becoming a doctor themselves. You could also become a director of surgery or the chief surgeon in the hospital. You could also own a practice or become a professor in a college or medical school. For the job outlook, the demand for neonatal surgeons is very likely to increase within the next 10 years with a 14% growth rate between the years of 2014 and 2024. In conclusion, surgeons garner a lot of respect in the medical field. I know many people attempt at going to medical school and drop out for several reasons, including it is too much money, it takes up too much time, or they have too little motivation to continue with their education. But I believe that I could make it if I keep my mind positive and persevere. If between 86% and 98% of medical school students can graduate and start their career, then I believe I can too. Here are my sources, and thank you.